This video demonstrates a posterior spinal instrumentation and fusion procedure performed by Dr. Peter Newton at the Rady Children's Hospital in San Diego. The x-rays demonstrate an S-shaped deformity of the spine known as scoliosis. This particular patient will be undergoing a thoracic instrumentation and fusion with pedicle screw fixation. The spine is exposed through an excision on the back as seen here. The facet joints are removed to provide additional flexibility and area for fusion. Pedicle screws are placed at each of the vertebrae to be used. This provides fixation to the spine. Rods are contoured to the appropriate alignment, and through approximation devices, the rod can be brought into the screws and locked with set screws. The rod is not locked firmly to the screws until the appropriate rotation of the rod has been achieved. This rotation of the rod provides a good amount of spinal deformity correction. With this completed, a second stabilizing rod is also applied. Together, these rods provide correction of the scoliosis as well as restoration of the normal thoracic kyphosis. With that portion of the procedure completed, derotation of the vertebra in the transverse plane is performed to aid in correction of the rib hump deformity commonly seen in patients with scoliosis. This segmental derotational procedure improves the overall correction of the deformity and can be done at each of the instrumented levels. Postoperatively, the x-rays demonstrate correction of thoracic deformity with spontaneous improvement in the lower lumbar deformity that was present preoperatively. The patient's activity will be limited for 6 to 12 months with full activity allowed after complete healing. This posterior segmental fixation approach for adolescent idiopathic scoliosis provides a reproducible means of deformity correction with excellent stability of the instrumented segment to ensure solid bony union between the instrumented segments. This leads to lasting maintenance of correction of the deformity with only modest reductions in spinal flexibility.
And this is a beginning video for anyone who's had a spinal fusion, particularly for scoliosis, as I have. I had my surgery 25 years ago, 1988, and I am fused from the levels of T3, which is pretty high, to L3. So I have 2 movable lower vertebrae. I'm a yoga practitioner and a yoga teacher. I love the practice of yoga and believe very strongly in the power of yoga to connect us to our bodies and to really appreciate and love the body that we were given, even with its curves, and then even after being fused with rods put in place. I know many of you out there have experienced this and maybe even had revision surgeries and don't feel safe and secure in your body. You don't feel comfortable in the body that you have now. You feel limited in your movement. And I would like to show you how through yoga I have been able to work through that and be very comfortable and at ease and secure in my own body and the movement that I have. So we're going to start off today with a couple of very easy yoga poses that you can do on your own daily to begin to open up the body, to really breathe and connect, and to regain some movement, some really good spinal movement in the areas that are unfused while still protecting your fusion and staying very stable and safe in your poses. So we're going to start in hands and knees on the mat. So I'm going to take hands and knees position, tuck my toes under, and just take a moment here to breathe. So I'm going to breathe very deeply into my body and just start to connect and soften, just soften my skin, soften the space between my shoulder blades, breathe deep. And then I'm going to take what I call puppy pose. So I'm going to take my fingertips to the top of the mat, stretch them out, and let my forehead rest on the floor. Now as I'm here, I'm going to breathe about 5 deep breaths as I decompress my spine. Just take the compression off, stick my seat way up in the air, press my fingertips down into the mat, and lift my arm bones more towards the ceiling. I'm going to bring attention to my lower belly and just draw my lower belly in and up to provide a little gentle support to my lower back, my unfused vertebrae. And after spending about 5 breaths there, I'm going to move on to lie on my stomach on the floor. For those of you just getting started with your fusions, you may find that lying on your belly is uncomfortable. Your front body has probably gotten very tight, and you've lost range of motion and strength in your back body. So we're going to work through that. So you'll start just by lying on the floor, point your toes back, turn your cheek to one side, keep your hands by your rib cage, and just lie here for 3 to 5 breaths. Now while you lie here, strengthen or stretch your legs back really long, spread your toes, press the tops of the feet down into the floor, and tuck your tailbone slightly under. So your legs are really strong and straight, and your tailbone is tucking under. So you're pressing pubic bone into the mat. And just lie here for several breaths, and then you can turn your forehead the other way, or turn your head the other way, and take 3 to 5 more breaths there. Now, if you're ready to move forward just a little bit from there, you'll rest your forehead on the mat and take a moment to lift your shoulders up towards the sky. You might find that it's really tight in your upper back between your shoulder blades. You might feel that it's a little sticky there. So just work on lifting the arm bones up, squeezing your shoulder blades together, and do that several times. All the while I'm keeping my legs toned, straight, strong, and firm. And then as I'm ready to move forward even a little bit more, I'm going to work on spinal extension. The extension here is going to come from my unfused lower vertebrae. So I'm going to begin to press my hands into the floor and lift my chest up into a baby cobra pose. Again, my legs are strong, squeezing in. The buttocks are loosely toned, so they are tight but not overly tight. And I'm going to lift my chest up, lift my shoulders up, lengthen my neck, and breathe here. And then I'm going to begin to move with my breath. So inhale, exhale, inhale, exhale, inhale, and continue here several times until over time you'll begin to get some mobility in your lower back in the direction of what we call extension, spinal extension. Very important for us with fusions to work the extension component of that unfused area, because we spend all day usually leaning forward, sitting, and that just keeps that lower unfused area in a forward flexed position. And we need to balance that out with spinal extension, which means you've got to get prone or on your belly on the mat in order to do that. So begin by working those two poses. That would be puppy pose and baby cobras. And let me know how you do. And then we'll continue to add on for some other videos and some other work for you to begin to find more mobility and more comfort in your body. Please visit www.juliewilkinsyoga for more information and feel free to email me with questions. Thank you.